20th already. Do you feel like it's already like this year is passing fast? Although, how many of you are excited it's spring? Like you can see the leaves are starting to bud. I don't know if any of you like get out your yard and like plant flowers and stuff like that, but it's like that's my favorite time of year. Spring is my absolute favorite time of year. And it's so beautiful out here. So anyways, welcome everybody. We're going to go ahead and so the roll call is the link that was placed, and you need to, as a voting member, go ahead and sign in so that Marielle can determine if we have a quorum. So the sooner you can get signed in, the better. Marielle, do we have any new members?
Yes, we have, or no, we have new voting members.
Okay.
Yes.
Okay, so let's see here. We have Goodwill of Southern California as well as Renewing Hope Strategies. Are any of you in the house with us today? If you are, I would love for you to say hello and say a few words. Anybody from Goodwill SoCal? Anybody from Renewing Hope Strategies? Okay, well, we go ahead and welcome them and look forward to their future participation in the meetings. Let's go ahead and move on to the next agenda item. And that is consent items. At this time, we're going to entertain approval of the February 21st 2024 Continuum of Care meeting minutes. Do I have a motion to approve the minutes? Come on, you guys, don't be shy. Well, I should have asked you, Marielle, do we have a quorum?
At the moment, it's rising. We have 15, so we're going to need another 15. But Linda, I see you're not able to access the roll call. I can put yours in manually. Is there anyone else having issues?
Yes, I am having issues. Amy Sells from Hoopa Valley. Yeah, it's making me sign in again. I don't know why it didn't do that last time.
Right, and I use the same settings, but I'll get your name down.
Also, Jasmine.
This has been
Letamendi. I'm not sure what organization she's with, but she says she's having issues as well. And Chris Olberg from Path of Life Ministries, and it sounds like Ben Howdigi with IEHP as well.
Correct. Thank you.
Let me look through the chat.
Thank you, Emma. What we can do, I encourage you all, if you're not able to access, please indicate your name and the name of the organization in the chat so that staff can go ahead and log in your attendance for you. And remember, it's right now we're just trying to establish a quorum for voting members. But what we can do for the interest of time is go ahead and move to the next agenda item, and then Marielle and Emma will keep an eye and let us know if we've reached a quorum. Does that sound agreeable to everybody? Okay, so let's go ahead and move on to the next agenda item. At this time, the Continuum of Care members will hear comments from the public on any matter that is not on agenda. Each member of the public may comment up to 3 minutes. Marielle, did we receive any public comments in writing?
No, none in writing.
Is there anybody with us today that would like to make a comment? If so, raise your hand. No public comments? You guys are all so quiet today. Do we need to get you all a Starbucks or some Diet Cokes or something like that? Would that be good?
Yes.
I have my Diet Coke here, you guys. See that? So I'll take.
So we have quite a few more agencies that logged in. If I could just update Mark, because I don't have a way of communicating to her.
Okay.
So we have City of Murrieta here, Lindsay Sisti, Albert Rivera with Step Up on Second, Monica Atkinson with DAP Health. We have Alyssa Tate with Transgender Health and Wellness, City of Paris, Rebecca Rivera, and Carol Albaugh with Faith in Action. Does that give us a quorum? Oh, also California Health Collaborative with Mamas y Bebés, Vanessa Ramirez.
And I got a text from our vice chair that said she's unable to attend the meeting, so.
Copy, thank you. So we have 2 away. We're 2 away from
Okay,
quorum.
did you
away?
get DPSS ASD, Jasmine?
Yes.
Okay.
Okay.
We can, yeah. I'll let us know when the responses go up as well.
Okay, that sounds good. Okay, so was there anybody that wanted to make a public comment? Just want to make sure that we're giving you the opportunity to make a comment. Did the slides go away? Or is it just my screenshot? I do not see them. Are they up, Marielle? The slides are not up for the agenda items.
Oh, sorry, I was muted. I'll get them up right now. I don't know why they went away. Sorry about that.
Okay.
There we go.
I just want to make sure I'm not going off the reservation here.
No, you're good.
Thank you. Okay.
No problem.
So let's go ahead and go on then. If we don't have any public comments, let's move to the next agenda item. Leadership Spotlight. I am so excited. I wanted to, as your chair each month, have the opportunity to reach out to all of the amazing partners that play such a critical role in our continuum of care, and thought that it would be super cool if we could spotlight Gordon and his amazing team that do such a phenomenal job overseeing and implementing the homeless management information system. And so much has been happening with the launch of the homeless action plan and the infusion of different funding sources, especially HIP and others. And Gordon is always so collaborative and so supportive and does his best with all of his team to make sure that each of us as respective organizations are supported and get the training and levels of support that we need to make sure we're doing the right thing in terms of entering data. And we all know, what does data do? Like, data shows us outcomes, data affects policy, and policy affects funding. So every time you think about, oh my gosh, the time that I need to input that data in HMIS, just remember how extremely valuable it is. So with that, Gordon, I'd love to turn it over to you. And I think you have some folks on your team too. So thank you so much for being such a rock star. We look forward to your spotlight.
Karen, thank you so much. That is a heck of an intro. Firstly, could not have accomplished any of that without the awesome team members, which I am actually going to pass it to. So I'm going to go ahead and pass it to Salam Walker and Annabelle Mendoza, who is 2/3 of our HMIS team, to say hello and introduce themselves. So Salam.
Hello, everyone. My name is Salam Walker, and I'm a GIS research specialist with the Continuum of Care HMIS unit. I'm happy to be here. Thank you.
Hi, good afternoon, everyone. My name is Annabelle Mendoza, and I am part of the HMIS team. I'm fairly new. I am the systems administrator for HMIS. Thank you.
Thank you. Mark, could you go to the next slide, please? So a couple of things I'm going to talk about here is that what does our data do in terms of its contributions and utilizations? And one of the things that, Karen already glossed over was our homeless action plan. So in order to meet the goals, track the status and all of the milestones, which reflect all the hard work that all of you are doing, the data has to, show that. So in the 5 action areas of our homeless action plan that is seen here, we take a look at the ever-evolving HMIS data with our enrollments, exits, funding sources and programs and effectiveness of housing our homeless clients, and how are we doing? Now, if you haven't taken a look at our homeless action plan, I highly suggest you do that. I included a link in the slides, so when you guys receive that, click on that and take a look. There are 5 action areas, but there's plenty of strategies that are listed in the homeless action plan in each of the areas and how we achieve that as well. And through that is where we apply and use our HMIS data to see how we're doing in those areas. We can go to the next slide. Now, if you all were here for the September meeting, I believe, for COC, this may look familiar. So this is the Homeless Action Plan evaluation that we have completed previously, and it showcases, how we are doing in the 6 of the action areas. And I wanted to post this slide here to, jog the individual memories of y'all folks. And then the next slide, we'll be taking a look at how we are doing right now. Now, pick 2 of the measures that we are looking at, because right now we are conducting our analysis of our annual criteria to see what we have achieved in terms of adhering to our homeless action plan goals. But as of right now, which is the data has been updated on February, it is showing that the number of newly successfully housed individuals are, oh, all right. I think we have.
Here. Let me go ahead and put those in for you. I'm sorry.
Oh, it's all good. It's all good.
Oh,
Thank you.
it's on the next slide.
Oh,
sorry.
Magic. Thank you, Mar. I appreciate that. So, so far, we've newly housed 3,364 individuals, and only 2,457 individuals were newly homeless that have entered in our fiscal year, which means our outflow is higher than our inflow. And that is awesome. We are literally reducing the number of individuals, who are homeless in our continuum of care in Riverside County. And as you see, goal or action area number 6 is a 75% reduction. And right now, in our fiscal year so far, we have 2,457 homeless individuals. So now, do want to let you know that, caveated, our HMI system, as you all know, it is a live dynamic system. So as enrollments are being entered and being exited, some of the data may change. However, based on the trend that we've seen right now, we're headed to housing the number of individual and doing as well as we did the previous fiscal year. So looking forward to providing another update once our final analysis have been completed. Next slide. Okay, so another area that affects all of us, and that's the data input side, which is our Clarity license, particularly our Clarity license increases. So we have been hard at work negotiating with our vendor, BitFocus, who supplies our HMIS Clarity. And we are near the conclusion of our amendment. And the one other aspect that needs to be done is county council approval, but we have substantially increased the number of general user licenses. And that's the licenses that individuals have to input data, to run regular reports, to exit individuals, to add services, track geolocation, and so on and so forth. The other aspect is we've drastically increased the number of looker reporting licenses. And for those who have one of those licenses, I'm looking at a few, Chance, John, who regularly create the customized local reports for your stakeholders, who review and kind of determine the trends and whether or not you're hearing your goals. Those individuals, we have increased the number of licenses drastically in our new amendment, which means that we are able to provide more than just 1 or 2 looker licenses per agency. So it means that you won't have to bear the sole load for creating the reports. once we get that amendment, completed. So, and this is to kind of follow back with what Karen was saying with our, HIP funding, which is to one of the measures literally was to expand access of HMIS. So one of our goals is to not only track and capture the data of our clients that are COC funded projects or Riverside County funded projects, but all projects in a continuum of care so that we can accurately reflect our homeless needs. So with this expansion of licenses, we are able to make that happen. Or if you go to the next slide. So to have a dialogue and a conversation and kind of get a better feel of the number of individuals who are either developing reports in your agency or actually review and take a look at those custom reports that your Looker developer creates. If you can type in the chat and kind of let us know like, hey, how many individuals, in your staff member actually develop reports? And this could be individuals who are using Looker or, download the data and develop, Excel reports. And then let us know how many staff members actually review those customized reports. And what we're trying to gauge here is when we're updating our Looker license issuance policy to kind of get a better feel of, what we're looking at in terms of agency needs. So if you type that in the chat, really, really appreciate it. Now, of course, we're not going to leave you high and dry and give you a license without some knowledge transfer. So we did our Looker workshop in the beginning when we first issued the licenses, which was a limited batch because, we didn't have as many licenses. But when the amendment is complete and we are ready to issue the licenses, after we've issued them to the individuals, we will be setting up a Looker reporting workshop to show you the ins and outs of our Looker reporting system. And this is for new users, but we'll throw a few intermediate to advanced techniques for those who are kind of coming back as well. So please look forward, to that. We want to equip you with the knowledge and the license to create the reports. All right, next slide, please. Last but not least, we have our HMIS geolocation workshop happening next month. Now, we've been talking about collecting more geolocation data in order to enhance our street outreach and our engagement process. There's so many benefits. And to further that cause, to ensure that everybody is knowledgeable and understands how to input the geolocation data, we're going to be holding a workshop next month, and we're going to teach you how to input the geolocation data from your phone, from your tablet, how to do the Clarity one-click, enter my location to substantiate the geo coordinates, and talk a little bit, more about our enhancing our system, with this information. So we encourage everyone who are our agency users to attend, but particularly our street outreach folks, because this is going to be geared towards you all, and you are going to be the instrument which helps us gather this really critical information. So please look out for that. We'll be sending out another flyer with announcements. So, and I believe that is it. So Karen, thank you. Mario, thank you so much for having us today. Hopefully some of this information was helpful, and I look forward to speaking with y'all next time.
1 second here. Okay. All right, can we go ahead and go to the next agenda item? By the way, everybody, we'll do like a whoop whoop for all of the HMIS team. Give them some love, everybody. Tell them how much we appreciate all of them, because they really help us countywide. So just want to say thank you guys again for doing such an amazing job. And also, Gordon, for being such a good sport at the last minute request. I really appreciate that. You
No
did a
problem,
great job
Karen.
putting everything together. Ayako, did you have a comment?
I do have a question. Thank
Okay.
you.
Yeah.
Ayako Utsumi here with Mary Erickson Community Housing. And thank you for your presentation, Gordon. I hear some conflicting opinions from CES at the state level and users on the ground, how well CES system HMIS collects acuity information in order to prioritize the most vulnerable to get services and housing sooner. And I also understood the County of Riverside was developing their own acuity system. Some additional fields would be added in order to prioritize those who need services sooner rather than later. Can you comment on that, please, how that works? Acuity and how you use reports.
Yeah, I can take that, Ayoko. This is Emma,
Sure.
EOC manager. So currently, and I see Monique also raised her hand, and Monique, more than welcome to unmute yourself and jump in as well. So we've been working with our Department of Behavioral Health, who is our coordinated entry system lead, for some time now to develop a assessment tool that will eventually replace the VI SPDAT, which is what we use as a community. Our COC adopted and has had for quite some time now to determine acuity and where individuals are placed within our community queue for placement into housing. And it's our vulnerability index, which we recognize has some inherent bias. But we continue to use in the absence of another alternative. And as we work towards implementation of the tool that is currently being developed. And Monique, would you like to add some details about the work that's being done and where we are? Or Dr. Larissa Villarreal, if you'd like to jump in as well.
Sure. I'm going to go ahead and turn off my camera because my connection is not too good out here in Mid-County. So hopefully you guys can hear me better when I turn my camera off. I did want to mention that, yes, we are developing a tool. We do have a contractor that we're going to be working with, and they're going to be taking into consideration behavioral health data, justice involved data, healthcare data. So this tool will essentially develop will identify those who are more at risk of death on the streets. And so that tool will help us to prioritize those that are most in need. But I do want to note also that while the VI SPDAT does have some inherent biases, unfortunately, we do have a remedy essentially for that. We do have a prioritization request policy to where if somebody feels that they haven't scored properly within that VI SPDAT or it wasn't properly reflected, they can always reach out to Home Connect and ask for a prioritization review. And so we do have a committee that does review all applications to appropriately assess situations.
All right, thank you. And so what I'm confused about is at Sacramento, they said the CES system absolutely provides acuity rating and you should be able to use that to prioritize. Why do we hear like your county and other jurisdictions still feel the need to come up with their own acuity prioritization system? Why is that?
Well, the VI SPDAT is our priority tool. So that is the tool that we're currently using. And so we're looking to replace that because we do see that there are certain biases with it.
Oh, I see. I didn't understand the acronym.
Oh, okay. Yes. So our VI SPDAT is our vulnerability index tool. So that is our vulnerability scale tool that we utilize to prioritize individuals.
And that's part of CES?
Yes.
Okay.
Emma, you're muted.
Ayoko, so every person who comes through our coordinated entry system and is is homeless, at imminent risk of homelessness or literally homeless, is VI SPDATed. That's how we determine where they fall on our community queue. And
Okay.
so referrals are then taken in order of hierarchy based on how they scored on the vulnerability index.
All within CES, and now
All
you're
within CES, correct?
okay.
Yes.
And so now because of the limitations, you're developing your own system.
Correct. And we do notice on those vulnerability scale tools as well that not everybody is forthcoming right away, right? So until we build that rapport with them, we have this tool eventually that we'll be developing that will take all of the data that we have in the system for them to develop what their need truly is.
Yeah,
I see.
Monique,
Okay.
I think that's
Thank
really
you.
important, especially because not even just those that are not forthcoming, but some folks are just so struggling with severe mental illness that their reality is different, maybe in some cases, in terms of what they perceive as not being mentally ill when they are severely mentally ill. And so sometimes, the case managers and the outreach workers know full well someone is just languishing and, suffering on the streets, but they will, articulate that they are not suffering from mental health or even like just so drug addicted. It happens. It happens a lot with people. And that's hard when the case managers know. So I love that, that our behavioral health staff and coordinated entry and HWS and looking at best practices and ways that case managers can weigh in. Not that you're overweighing people's rights, but where people really need help, that the case managers can weigh in on what the person is experiencing and therefore the impact of the score for resources. Did I say that right, Monique?
Absolutely, because nobody knows this population better than the case managers that are working with them.
Yeah.
So thank you for that clarification, Tara. So your new system takes into account additional databases outside of CES and then streamlines it so that you can come to a more accurate prioritization.
If I could just jump in, and Emma tagged me. So thank you for that, Emma. I appreciate it. I just want to add that, yes, this is an opportunity for us to identify those high utilizers of emergency services. And so it will pull from those different platforms to provide a larger picture for us. And it will help to eliminate that inherent bias that currently our VI SPDAT has embedded within it. And so what we want to do with this tool is ensure that we are being equitable across the board in that assessment for the individuals that we're working with in the field.
Got it. Thank you. Very helpful. And kudos to the county for going the extra step to help prioritize the most vulnerable. And I hope that you have some kind of dispensation for older adults because they are so much more vulnerable.
Great comments. Anybody else? I love it. Thank you so much. I love this rich discussion. It's so important.
So Ayoko, just real quick to the comment on the older adults, just to allay any concerns you might have. We do have a very close partnership with our adult services division, and any person who is over 60 and over who is literally homeless automatically has a report. The individual that is assessing them and taking in their information is required to report that information over to adult services, and adult services will then assign a caseworker and make sure that they're following up with that individual to address the concern, and based on age and medical issues and other things will place them immediately if needed.
Great, thank you for that. That's great news. And just a point, UCSF produced that homelessness, the statewide report on homelessness, and they identified that age 50 is the new 75. So people on the streets, chronic homelessness, people who are 50 are actually medically age 75. So just to a thought, we know that funding is for specific ages, so you can't just decide, oh, I'm going to change it because then you won't get funding. But just so that we're all aware that 50-year-olds, chronically homeless 50-year-olds are medically aged and therefore more vulnerable.
Love it. You always do such a great job, Ayako, with being a great advocate and the consulting work that you do at the state level. You know, our county's been privileged that you've joined us in that. I know you had our superstar Tanya speaking at a statewide event previously to share our best practices. So I just want to thank you for always being a voice for older adults. And I'm a huge supporter of what the amazing partnership between you know, HWS and Aging Services for vulnerable adults. That's a great tool for investment of continuum of care resources for those extremely vulnerable older adults. And I've seen that program in action with people that we've collaborated with. It's amazing. So any other comments? Okay. Let me ask, Marielle, do we have a quorum yet?
Yes, we've established quorum.
May we go back to the minutes then so that we can take action? All right, so I'm going to take us back to agenda item 2, consent items. If we could please entertain a motion for approval of the February 21st, 2024 continuum of care minutes. Do I have a motion?
Linda Krupa will move approval.
Hey, Linda, thank you so much. Nice to see your beautiful face.
Karen Younglow from Lighthouse seconds it.
Who was that?
Karen Younglow from Lighthouse.
Thank you, Karen. Nice to see you too, beautiful lady. Okay, do I have any abstentions? Any abstentions or objections? Hearing none, the item passes. Okay, thank you, everybody. Let's go ahead and move on to the next agenda item, new business. Okay. Oh, look, you already had it in there. You're so good. I was texting her, hey, can you pull up the conference flyer? And she already had it in the PowerPoint. You're like 20 steps ahead of me, Marielle. Thank you so much. So everybody, if you were in the Policy Advocacy Committee meeting, you know, I was like hugely excited about this reentry conference. And, you know, in the Policy Advocacy Committee, we did a call to action, not just to sign up to attend the conference, but also to get more involved in reentry. We do have a reentry working group as part of the Policy Advocacy Committee. And it's really, if you think about our whole continuum of care system and those that are justice impacted, for us to be able to be proactive and focusing on this particular issue, it affects so many people. And we want to be able to have a solid system that's going to be able to help people overcome barriers to employment and housing and other things that would otherwise keep them from starting a new life after they have been discharged from jail or prison. And so I'm super excited that we've collaborated to work with Starting Over to host this conference. And I was going to ask for you all to enroll, but apparently we're booked full. So I'm super excited. We're going to have a very well-attended conference. And there's going to be some amazing speakers that are there. And we're just going to have a great day of focusing on this very important issue. But also just know it doesn't end there. We want to have follow-up with our reentry working group and then also have discussion about the notion of establishing a reentry collaborative. And we don't have more information on that. I think it's just a conversation that's going to evolve. But I just wanted to give you all that call to action. It is such an important issue. So anyways, and Larissa, I'm so excited that you are back to joining us in this important issue because you've done such a great job supporting this effort from the time that we were, when reentry working group was just getting started, right? So
Thank you for that, Karen. I'm super excited to be there and to sit on the housing panel. So looking forward to seeing everyone and interacting with the attendees. So see you there.
Do we have Vanya in the house with us today? I'm looking, I do not see her, either Vanya or Griselda. I don't see them. I was gonna ask them if they wanted to say something. And Emma, you've been such a dear helping with planning. Did you want to say anything, my dear? Because you've been behind the scenes helping, doing such a great job pulling logistics together. So would you like to say something?
Absolutely. We met this morning for another planning meeting. Things are, stacking up quickly as the date approaches. We have really great panelists that are coming and confirmed to speak on many different issues, such as funding, finding funding, talking about re-entry in general. We have some persons with lived experience, and we have one business that is coming to talk about their experience in hiring second chance participants. We also have a panel on housing and specifically related to housing individuals that are justice involved or formerly justice involved. So a lot of really, really great discussions that are to be had. We have a keynote speaker, Kim Sawatari, who is our public health department director, who will be presenting. We are at full capacity. There was 250 individuals that were able to attend, but there is a wait list that is currently open. So if you have not signed up and are currently not on the wait list, you can add your name to the wait list, but we are at capacity. So it's just so wonderful to see so much interest, and we're really excited about having everyone there and having the opportunity to learn and to share and network amongst all of the providers.
How's that for being quick on your feet, everybody? She didn't even know I was going to ask her to do that. You always do such a good job, Emma. Thank you.
My pleasure.
Okay. Does anybody have any questions or comments about this exciting conference and just the topic of reentry? If I were to ask you to raise your hands, I bet you so many people would mention that this particular issue impacts so many of your clients, right? So I'm excited for us to remember that I called you all a big blanket of love, right? To actually move this issue forward to make a big difference in our region and move the needle. So, okay, let's go ahead and move on to the next agenda item. All right, agenda item 6, standing items. A quick update on the Board of Governance. So first of all, how many of you saw Tanya's exciting email today about the new officers for the Board of Governance? So I just wanted to give a shout out. Leticia Delara is the new chair. She was serving as the vice chair, and Dr. Ben Howdigi from IHP is now the vice chair. Both amazing people, do an amazing job. They're going to just be phenomenal. So wanted to give a shout out to them, but also, of course, for all of us to just give a big thanks and acknowledgement to Dr. Matthew Chang, who, of course, is our wonderful head of Riverside University Health System Behavioral Health, and he served as the chair since 2022, alongside of Leticia, who was serving as the vice chair. So anyways, I just wanted to make that announcement in case you missed it. Just quickly, I'm just going to run through this. We had a really super exciting Board of Governance meeting and had the opportunity to participate in some decisions for the allocation of some funding for our region. So there was $200,000 in ESG funds that was initially allocated for housing relocation and stabilization services for senior population, and staff got clarification about the use of the funds, and it will be available to all populations. And so Housing and Workforce Services, through I believe the Housing Authority, collaborates with Coordinated Entry System in order to select clients for that pot of money. So always great to be able to see resources available to everybody. And then also there was a lot of robust discussion about the opportunity to allocate HAP funds from round 3 to support a coordinator position in the Veterans Service Office, given the PIT numbers that were identified in terms of the number of homeless veterans, which I believe was about 256, if I'm not mistaken. And you think, kind of like looking back how we at one point had achieved functional zero and wanting to be able to get back to that. And really, it's a complex issue that involves coordination with a lot of different organizations. And the Veterans Service Office already has veterans that are working there that are doing an amazing job processing claims and helping vets to get connected to critical resources for having served our country. So what better place to have a coordinator position? And so there was approval of $170 some odd thousand for that position, with the goal that that would be seed money, so that future money could be secured to sustain that very important position in our continuum of care. And then last but not least, I was super excited to see how the staff did such a good job from HWS in structuring this agenda item. It was for a combination of ESG and HAP funds that were awarded to CVRM and CityNet to provide rapid rehousing. And what was really cool about how this $529 some odd thousand was structured, it's going to cover the whole entire county. So the way that the funding was allocated was in every single supervisorial district, and the allocations were specific to the need related to the point in time count. So if you look at that agenda for what the Board of Governance took action on, you'll see those very specific numbers. So there's your homeless action plan and your data in action that HWS does a good job targeting unmet needs. So Tanya, I didn't know if there's anything else. Did I do okay covering the items? Is there anything else you might want to add or?
Nothing to add. You always do such a good job, but I will take advantage of this moment, as you did, to congratulate our new chairs, and then of course to encourage all of our Continuum of Care members to join us for our Board of Governance meetings that are held at the City of Banning's chambers. We'd love to have you there. I know in the past we've had Robin Gilliland, Michelle Davis, our vice chair has been there. Our chair is always there, of course, because she's on there. But we look forward to any opportunity we have to be able to connect with you guys in person. And so I just want to encourage you guys. I know it's a trip. We meet usually every other month unless there's a special meeting. Our next meeting will be in April, as Karen mentioned. But please, I would strongly encourage you guys to come. The public comment period, I think, is a special and unique opportunity for you guys to come in and talk about your different programs, what you're seeing on the ground. I know the board really appreciates being able to hear directly from providers. It's our favorite part. So thank you, Karen. Great job as always. And hello to everyone here.
Thank you, Ms. Tanya. Okay, everybody, let's go ahead and move on to the next agenda item. Okay, agenda item 6.2, the Continuum of Care Lead Agency Update, and we have our lovely Emma. Emma, the floor is yours.
Thank you so much. I was just responding to a comment in the chat here. All righty, let me get this going. Just wanted to again say good afternoon and thank you for joining us for our monthly COC meeting. My name is Emma Perez-Singh, COC Division Manager, serving under the leadership of Heidi Marshall, Mike Walsh, and Tanya Torno. It is my pleasure to share the COC update with you this afternoon. I would like to start off by introducing you to 3 of our new staff members. And perfect. Thank you, Mar. I've asked them to quickly share about their new roles with HWS so that you can get acquainted with them and you know who to contact when you need them. Terrell, would you please begin?
Good afternoon. My name is Terrell Rimbo. I am the Housing Specialist 2 for HWS. I will be heading the Hope to Home project, which is a project where we are doing an initiative to bring landlords and also our service providers together to share this platform where we are able to have landlords place their units in this platform that are available. They do get incentivized for using this platform as well. And then our service providers can also put in the units that they have or that they know that's available so that everyone can kind of have just one pot where all the units, all available units in Riverside County are that are available are in this platform where our service providers can go ahead and be able to access these units and apply. So that's what I'll be working. That's what I've been working on with Pad Mission and the website that we're working on, and we're hoping to launch it. We're actually doing a training next week. So that's my little update.
Thank you, Terrell. Mireya?
Hi, thanks, Emma. Hi, everyone. My name is Mireya Orozco. I'm a program specialist too with the Housing and Workforce Solutions within the COC division. So I oversee the projects and programs covered by the HAP and cash grants. So some of the eligible activities are like rapid rehousing and street outreach. So that's essentially it. I've been enjoying my time here with HWS, and I have a wonderful team to collaborate and learn from. So I'm always very excited to learn more in depth about all these different supportive programs that HWS offers and related to homeless individuals within the county. So thank you.
Thank you, Mireya. And next we have Damaris.
Hi, everyone. My name is Damaris Martinez Marufo. Very excited to join the team as a new program specialist. I will be overseeing the ERF programs under Santa Ana River Bottom, San Jacinto as well, and the ARPA. Very excited to see everyone on the call, helping you all through any, support needed. So feel free to reach out if you have any questions, but just excited to be part of the team.
Thank you very much. Next slide, please. All right, I am going to quickly turn it over to Ms. Rashana Walker, who is the COC program supervisor here to provide an update on the Hope to Home initiative. Terrell touched on it just a bit, and I'll let her just share a few more things about what we're doing and what's to come.
Thank you, Emma. Good afternoon, everyone. And like Emma said, my name is Rashana Walker. I am the Supervising Development Specialist here with our Continuum of Care team. And just wanted, like, as Terrell mentioned earlier, he has been working, as soon as he became part of the team, he has hit the ground running on our Hope to Home Landlord Collective. With that being said, just to give you an update, on February 14th, we had our first launch and program overview and training for the Hope to Home initiative. And I do want to back up and just point out, I don't know if you guys noticed, but our new logo, we worked with our consultant, and our consultant worked with someone who was just starting out in web design, and she designed this logo with our input for free. So that was one good thing that came out of that. But just want to acknowledge that's our new Hope to Home logo. But on February 14th, we had a packed house for that launch, and we got a lot of positive feedback, a lot of excitement about this landlord collective. And we will continue to work with our consultant. And as Terrell mentioned, there will be a service provider training on this coming Monday. Calendar invites have been sent out, and I just want to let everyone know that they have been sent out to the housing providers, only, because the funding is tied to the housing providers funding. So this is not additional funding for rapid rehousing. It's already it has to be tied to a rapid rehousing provider. So I just wanted to provide that update. As Terrell mentioned, he has been working alongside our IT department and our consultant on working on our new website. And so that will be up shortly, and the service provider training will provide a walkthrough for our new website and our Pad Mission platform. And that was all. And Terrell, if I miss anything, please feel free to chime in.
No, you did great, Rashana. Thank you.
Can I ask a question? I'm sorry if this is a dumb question or I forgot these details. Rashana, can you remind me, does this also include all the landlords that are already signed up through the Housing Authority, since that's a big bucket of landlords that are already accepting Section 8 or project-based? Yes?
Absolutely, Karen. As a matter of fact, our initial outreach is being done through the Housing Authority's landlord list. So great question. We have already started our outreach for those landlords since they already know how these types of programs work.
Awesome. Do you know how big that portfolio is? I'm just curious if because sometimes there are big landowners that might, own, they're a corporation, they own big blocks, and then there's lots of little mom and pops and stuff like that. I'm just curious.
So I don't remember the exact number off the top of my head, but it was well over 600.
Okay. Well, that could be a lot if some of those are the big corporations, because that 600 landlords doesn't mean units, could be like gazillions of units, right? Yeah,
Right.
that's cool. Awesome deal. I'm excited about this. Good job, you guys. Woohoo! Go Rivco!
Thank you.
Any other questions and comments? And I love the logo, by the way. Very inspiring. Anybody else? Okay, it looks like we have a question here. Is there a question or no? Did I miss someone?
If there is anyone, I saw, I think it was Dr. Mason had her hand up. If there are any housing providers that did not get the invite because we went off of the sign-in sheet from the February 14th meeting, there are any housing providers that would like to attend the service provider training, please reach out to either coc@rivco.org or hopetohome@rivco.org. We even have our own now email for it.
That's awesome.
Is it the number 2, Rashana?
Yeah, no, it's 2, T-O.
Okay.
No, it's the number 2 for the email. Sorry. Hope to the number 2 home. I'll put it in the chat.
There we go.
I'm putting it in the chat right now. That's what I was asking.
Okay.
Confirm that, Terrell. It's because we went back and forth from T-O to the number 2.
All right, thank you.
Next, unless it changed, I have 2 TO that I got an email from you guys, HOPETOHOME@rivco.org.
It's TO. It's
TO.
Yeah.
Sorry about that. I know we were going back and forth, but.
Thank you, Danielle.
All right.
Anything else, Miss Rashana?
That is all, Karen. Thank you.
All right. Always wonderful to have you, my dear. Okay, let's go to the next agenda item.
Oh, we're not done yet.
Oh, I'm sorry.
That's okay.
Go ahead,
next
Emma.
slide, please, Mar.
I apologize.
All right. That's okay. No problem. Just some quick updates and then sharing with you that the COC has been on the road in Riverside County. So first update, our HHAP 5 application is full steam ahead. We are ready to, well, I should say we have our draft that is about 95% complete. As many of you know, we hosted a feedback session at our last COC meeting and received a lot of great input from you. That input has been reflected in the application. Our due date to submit is March 27th, but we are aiming to have our application completed by the end of this week. So just really excited about that. Thank you to all of our partners that participated. We could not have done it without you. YHDP, for those of you who are newer to the COC world, that stands for Youth Homelessness Devastation Project. Our Continuum of Care was awarded this grant for the first time last year to develop a youth-specific system of care. Part of the process is to develop a coordinated community plan with under the guidance of HUD technical assistance providers. So we've been working with them, youth partners, our YAB, our Youth Advisory Board, our Youth Advisory Council, our education providers, our individuals or organizations that are working in the labor force, all to develop a plan to eradicate youth homelessness in or reach functional zero within our county. So we are on our way to finishing up that community plan. A lot involved in getting us to this point, lots of work group meetings, lots of in-person meetings, a lot of feedback, working very closely with our HUD TA providers. So we did end up requesting an extension. That was a question at our last meeting. The extension was granted. But even with the extension, we still have a very, very short timeline an aggressive timeline that we need to meet. So we are on target to submit our CCP no later than the first week of April in order to have enough time to go through our bidding process. We will be issuing an RFP for various types of services to support our youth system of care. We have to have all of our projects awarded and uploaded into eSnaps by July 1st. And this is HUD's deadline with an anticipated program start date for all awardees on October 1st. So as you can see, we are in the middle of March already. It doesn't give us too much time to get through that process. But we make miracles happen here. So we are going to get it done. I wanted to give a shout out to our wonderful Monique Guerra, who has just been an immense asset to our team and has been leading the charge with this YHDP effort. Mar Sarmiento as well, who is our COC coordinator and has been moonlighting on our YHDP team, just keeping everyone on track and keeping everything together. Gershom Haran, who is also on our youth team, and their supervisor, Amy Primrose Puente, for all of their hard work on this project. All right, next slide, please. And I promise I will.
Emma, before you move on, may I make a comment?
Yes, absolutely.
And ask a question? So I'm sure this has come up in your meetings with all of the stakeholders, but I just want to make this comment for the record, just in terms of how everything is being planned and coming together for YHDP. I really want to emphasize the critical importance of partnering with our community colleges who have so many different homeless youth that need support. And I hope that we can, as we're developing these plans, to be creative, to develop some strategies where they can be partnered with nonprofits to do things like sheltering and housing, like motel sheltering and rapid rehousing and whatnot, because they do have so many homeless students. And I want to give a shout out to Kimberly Thomas from Norco College. She's an amazing advocate for homeless students, and we have the privilege of working with them right now to support a number of homeless youth. And I know that the other campuses, RCC campuses, and even across the county would be great partners in this. And Emma, I'm sure it's being discussed, but I just had to say what was on my heart.
Yeah, thank you. Absolutely. We've included all of our community colleges in our education work group, and they are meeting weekly to discuss, priorities and strategies that we'd like to include within the CCP. The CCP is going to guide the drafting of the RFP, and agencies will need to apply under the specific activities that are going to be listed within the RFP, and all individual organizations that apply will be evaluated by our Youth Advisory Board and other individuals, agencies within our continuum of care. So definitely a really exciting time. I am just so excited about being able to build this system out. We know our youth are one of our 4 target populations in our homeless action plan. And, I know I can speak I can speak for all of us that none of us want to see any youth homeless on the streets of Riverside County. So very exciting. We will be communicating information to all of our COC partners when the RFP is posted. We'll have a pre-bidders meeting. We're going to be providing some intense technical assistance for any agencies that are newer to the game and not quite sure how to navigate the county bidding process. So a lot more to come on that. And actually, Monique has a formal update that she's going to provide at our next Board of Governance meeting.
Awesome. Good job. Well, I'm excited for this next round, and I hope that HUD's going to be back here with one of those massive checks, Emma, that we get to see. Like, right? What weren't we like one of the second or third largest allocations? We got more than we asked for, right? So everybody.
Yes,
let's show the love to HWS as they're pulling everything together, and let's hope for another big, huge, fat allocation. We can bring home the bacon to help more youth.
Yes, thank you. All righty. Next slide, please. And next slide. Thank you. One up. So we've been very busy at the COC over the last month or so, attending community meetings, opening of projects, trainings, and I just wanted to share a few of those with you. Supervisor Karen Spiegel, who sits on our Board of Governance and is on the Riverside County Board of Supervisors, hosted a second district homeless symposium where we had many individuals attend, over 100 individuals attend, agencies, advocates, cities, to share about the work that's being done within that district to support housing and support homeless individuals with services. So I just wanted to share a few pictures there and give them a shout out. Next slide, please. Also, our very own Tanya Torno, Deputy Director, was one of the speakers, the best speaker of the morning at the State of the Fourth District event. It was an inaugural event that was hosted by Supervisor Manuel Perez, and we had the opportunity to highlight our department and the work that's being done in developing affordable housing in the Fourth District, as well as homeless services and increasing our shelter capacity in that area. And Tanya gave a wonderful talk about the work that's being done and the impact that our continuum of care is having in the Fourth District. Just so proud of all the work that we've all done collectively in housing individuals and being able to develop affordable housing units and serve many individuals. I think we were talking right before this meeting that we've already housed more people this fiscal year than we did at the same time last fiscal year. So exciting stuff. She'll be providing a formal update to the Board of Governance with all of those statistics. I don't have them on hand, so I can't provide them for you, but just know that we're doing really great work and wanted to share that we, were able to be a part of that. Next slide, please. Also, COC was at the National Alliance to End Homelessness. As you see there, Mr. Javier Lopez from Valley Restart, Executive Director there, joined us, and we got to share some time together talking about the work that's being done, what we need to do, what we could do better, learning from other communities. We also were able to meet with Ms. Hafsa Keika, who is the Homelessness Senior Advisor to Government Gavin Newsom. She will be one of the speakers at the Reentry Conference. Our neighbors at the County of San Bernardino were there, Carrie Harmon and Mr. Marcus Dillard, who were formerly with Riverside County, got to talk about, what we can do as a region to affect change within our area and also how we can collaborate together. We had lots of folks from behavioral health there, Monique Torres Rodriguez, who's the manager over CES, and Dr. Larissa Villarreal, who's the HOPE administrator, and our outreach supervisors were there, and we just all had such a great time learning about what's being done and how to better our system of care. Next slide, please. Also very excited and giving a huge shout out to Greg Rodriguez, who was instrumental in developing this project from the very beginning. The Palm Springs Navigation Center had an open house. We were able to tour their 56 shelter emergency congregate shelter, as well as get to peek into where they will be having some of their transitional housing modular units set up. We were not able to tour those units. They're still under construction, but just very exciting work. Just increasing, again, our housing and shelter capacity in the desert region. And we have Mr. Noe there, who is with Desert Hot Springs. They also just opened up an emergency shelter, 26 beds in desert to support Desert Hot Springs, and also a navigation center. Next slide. And that is all. I think I took longer than I anticipated, but thank you very much. If you need to reach out to me, my email is on the screen. Always happy to chat and connect with you. If you have any questions, please feel free to reach out. Thank you.
Nice job, Ms. Emma. Go team HWS. Okay, let's go ahead and move on to the next agenda item. Okay, we have the CES lead update. Lucy.
Hello, can everyone hear me? Yes, okay. So I'll be doing the CS lead update for the month of February. Next slide, Mark, please. So for the month of February, we did have a total of 2,189 calls to our Home Connect, which was about a 17% decrease from last month, from the month prior, which was 2,641. A couple of highlights, we did add 10 more consumers to the community queue compared to January, and 60 home connections were completed, 58 of which were placed into housing, with the other 2 having other exits. Some themes that I did notice was there was 126 calls identified as literal homeless that came in through Home Connect, which is about a 30% increase from the 97 literal homeless phone calls in February, or in January, sorry. And it could also, those numbers could have been an increase due to the heavy rain and cold that we saw in February. I did post some numbers on there, just a breakdown of the literal homelessness based on the population, families, TAY, seniors, vets, and yeah, that's it for me.
Does anybody have any questions for Lucy?
Hi, Karen. This is Rashana. I just want to ask Lucy if she can share the homelessness prevention opportunities that we have in the county that was mentioned in Karen's update.
Oh, yes. I did partner with Rashana to introduce the ESG homeless prevention grant to our Home Connect staff. So this grant does support with moving costs, rent arrears up to 5 to 6 months, and it is a funding opportunity that opened in January and is available through August, the end of August. And I believe Rashana mentioned that it would have the money would have to be allocated by, I believe you said the 7th, Rashana?
August 7th. We have to have all of it spent by August 7th.
Yes. So there's a screening tool that is available and that the consumers need to be screened for. And that it goes over the income, household size. It does, participants do need to be under the 30% AMI. And like I mentioned, they do help out with rent for any units that are within fair market rate. So that is a very important distinction. They do have to be within fair market rate. We are seeing a few that are being screened that are the rent is just over, so they don't qualify. Aside from that, I don't have anything else. Rashana, if you wanted me to go more into it, I'm not too sure what else you wanted me to.
Rashana,
that was perfect.
Can I ask a question? Is there, you mentioned like 5 months, is there a cap per client? Or is it just on a first come, first serve and need basis, depending upon, so that you can be kind of fluid to meet the objective? Rashana's shaking her head.
There's not a cap per client because everyone's household need is different. So there's no cap per client.
Okay.
But with the caveat that we can only do 6 months in arrears.
Oh, 6. Okay. That's great. Nice teamwork, you guys. There's another example of HWS and behavioral health working together. Love it, love it. Any other comments or questions regarding this agenda item? Okay, hearing none, let's go ahead and move on to the next agenda item. Okay, so informational items, you'll see the committee reports in the Google Drive for the Youth Advisory Committee and the Policy Advocacy Committee. This was I always love signing the letters of support. We didn't see any letters of support. Those are like always fun for me because that means more resources to the region. So don't be shy, you guys. We love to sign them and support you all if you're writing grants. And then also there's the annual performance report for behavioral health coordinated entry that's in the Google Drive if you want to see it. So next agenda item. At this time, we can entertain a call for agenda items for the next meeting, which, oh my gosh, it's going to be April. Can you believe it? Anybody have any suggestions or requests regarding agenda items for April? Okay, hearing none, we can move on to the next agenda item. Okay, now you guys better not be shy because this is the time for you to give announcements. And I know there's a lot of super amazing things happening across the county. So please, can we see a show of hands for people that have exciting announcements? What is going on in your organizations? What exciting things do you have to report? It could be something small, could be something big. Anybody want to share anything? Okay, Melanie, let's hear Melanie and Carol. Yay. Okay, we'll go Melanie first.
Hi, my name is Melanie Robledo, and thank you guys so much for extending this invitation. All of the information is very useful, and I plan to use it in our current services. What I wanted to share with all of you is that we will be hosting our Second Chance month celebration here at the Center for Employment Opportunities office in Riverside. We plan to have over 25 vendors, several different speakers, and if you want to, I'll drop my email. If you want to chat me, I can definitely send the invitation to everyone. We really want to get the community involved, especially individuals that could really benefit from these resources. So super excited and happy to share.
Awesome. That's what I love to hear. Okay. Carol?
Okay, can you hear me okay?
Yeah.
Okay, this is Carol Olbach from Faith in Action of the San Gregorio Pass. And we are offering a free life skills program for anybody that would like to come and learn all those basic skills of getting out there into the community. It's going to be in Banning, and lunch will be provided. There'll be a certificate at the end, and lots of connections to other resources. So I invite any partner to find out more about it. And I'm going to do my best to put it in the chat. I'm not real technical here, but I'll try. And if not, I'm going to put my email, and you can email me and I'll get you the flyer. So thanks a lot. And I hope we have some interest out there.
Thank you, Carol. Anybody else have any announcements? Okay, hearing none, let's go ahead and move on.
I do. This is Becky from JFS.
Oh, hey, Becky. Yay. Hi, Becky. How are you, my dear?
Hi, good. I wanted to let everybody know that we have now opened up we have a second office in Moreno Valley now.
Oh, cool.
So, just so you guys know, anybody interested, I can get you the address, but.
That's cool. Does that mean you are expansion of services, or just so it's easier for staff because you're
expansion? Yeah, more services.
And what are you guys deploying out of that office?
Out of that office is a lot of community supports through IHP, and we have some other services that are hoping to come out of there soon.
Do you mean like the enhanced care management, or what do you mean?
Well, through our partnership with IHP, we do a lot of case management out of that office.
Awesome. Well, you guys do a phenomenal job. So love to hear expansion of services. That's wonderful. And it looks like we have the famous Christopher has something. Christopher, you're up.
I do have something, and it's an announcement, personal announcement. This will be my last CLC meeting.
What?
And I will be leaving Riverside County and joining the great Marcus Dillard in San Bernardino County as a housing admin manager for San Bernardino County Office of Homeless Services.
Congratulations.
Well, congratulations. These are always bittersweet because, you know, we love you. You did such an amazing job. But this is an opportunity for you. You can continue to take that blanket of love and all your experience and transform lives in San Bernardino County. They're a neighboring county. So hopefully we'll get to partner with you still. You won't forget about us and we can continue to share best practices and work together.
Oh, for sure. Definitely reaching out to a lot of you here once I start getting working over there.
Awesome.
Thank you. If I can jump in, Chair, I just wanted to take the time to acknowledge Chris. Chris, since I started with the county in 2014, I have worked with you and I know, right, your experience here goes farther back, and some of my fellow COC friends who are on the line have probably worked with Chris throughout the duration of time or longer. So just know that we appreciate you taking the time to join us today. One of the things in social work we know is that closure is important, and I think it's important to celebrate each other as we advance, even though it's heartbreaking, into other opportunities that may not allow us to work together day to day. But as Emma shared in the chat, congratulations, and just know that it has been a pleasure working with you. You have been a to-go-to for many of us, helping us bridge the housing and behavioral health sectors so that people get services that they need, and especially on the administrative side, making sure that the contracts and all the grants flow as they need to. So it's been a pleasure working with you and housing people, and we wish you the very best in San Bernardino County. Please stay in touch.
And I'll just say, Tanya, we can reflect because Chris was part of the big team when we all went to the National Alliance to End Homelessness Conference in Washington, D.C., and all the amazing conversations that took place about dreaming big dreams and collaboration and best practices and even challenges. So Chris, I hope we'll be able to continue those conversations and get to learn and hear new things in your new chapter of life. So
thank you. And I just also want to thank HWS. The whole team's amazing. Everybody over there has always been very supportive, and anytime we needed anything clarification, they were always they're willing to step in and help out. Thank you, everybody.
Awesome. Well, that takes us to adjournment. I just remember at the bottom of your agenda our upcoming meetings, so you'll see when the next meetings are for the YAC and the YEB, the BOG, Continuum of Care, and the EFSP are all on there so that you can do future planning. And of course, the calendars are all on the Continuum of Care website as well. So just want to wish you all a beautiful rest of your day. Thank you so much for participating. Your perspective, your participation is critical to the success of this region and most importantly for the transformation of lives. So thank you all. Have a great day. The meeting is adjourned.
Thank you. Bye, everyone.
Thank you.
Thank you. Great meeting. Bye-bye.